Well, the number of novel coronavirus cases in India has risen now to 116, with 4 more cases being reported in Maharashtra and the first case being reported in Orissa. 10 people have so far been discharged after treatment. Now, globally, more than 1,62,000 have been infected. Over 6,000 people have died. Amidst a rising number of coronavirus cases in India, the government has asked people not to panic, saying no community transmission of the virus has been observed and that there have only been a few local cases of transmission so far. What we actually plan to do on this program is bring in some leading doctors and then take your questions as well. You've got the number there on your screen. But in all of this, some important news that needs to be shared is that there's been a further addition to the travel ban which exists. So from the 18th of March, there is a ban on travel from the European Union, the European Free Trade Association, Free Trade Area, and from the United Kingdom. So those who want to come into a country will just not be allowed. And the new rider doesn't actually say whether Indian citizens will be allowed or not. It seems to be a blanket ban. And there are further restrictions for those who come in from the Middle East. So it's important to actually see what that is all about. But joining us now, Dr. T.P. Lahane, the Director of the Medical Education and Research Maharashtra. And we're also joined by Dr. P. Raghuram, President of the Association of Surgeons of India. I'd like to thank both of you very much for joining us. Dr. Raghuram, a question to you first. The number of tests we've done in India, I think after today, would be about a little more than 9,200 to 9,300. Now, if you compare that with the number of tests done in South Korea or China, which have been several lakhs, then it's clear that India has not done enough tests. Is that likely to be problematic?
Yeah, it's a good question. And first of all, I think we must all salute the government of India for really coming forward and putting its best foot forward in dealing with this unwelcome visitor in our lives. The answer to your question specifically is no, we are not doing enough because our target for screening is there are certain criteria, and so we still, although the view is that the infection is not already within the community, it's very hard to say that unless we screen a larger number of people, because there is a difference between what is the official number and what is the true number of people who have this disease. So to know the true numbers, we need to be screening much more. And South Korea has screened more than 250,000 over the last few days, whereas we have screened only 7,000. So I'm glad that the ICMR, I understand today, has taken the decision to screen, to extend the indications for screening. And they will be screening a lot more patients, a lot more people than they are doing at the moment.
Okay. We've got a phone call. Our first caller, Dolly from Bengaluru. Dolly, can you go ahead with your question, please?
Yes, doctor. From past 5 days, I'm down with cold. I had runny nose and a sore throat, but no headache and no temperature. Yesterday evening, last night, I had temperature. I took a paracetamol tablet, and it came down. Now I'm not finding any symptoms, but I have a cold.
Okay, that's an important question. And Dr. T.P. Lahane, you would be getting these questions a lot. She has a cold, she took a paracetamol, there was some fever, it's gone down now. And so she's obviously worried about COVID. So how would you respond to somebody who comes with this list of ailments?
See, what she says is she was having a temperature, but now there is only cold. Now in this situation, what I will advise, that it is very, very important that the history, that has she came from the country where it is a endemic or affected country. Secondly, what I will say is, has she got the history that she has came in contact with the person who has got the COVID-19. If she has came in contact with someone and history is positive, then she should be worried and test should be done. And if it is not came in contact, because today our disease is in India, it is only in the second stage. It means the people who are coming from other country, they are affected, or near people who are in contact, they are affected. So she should not be worried for that. And as just Raghuraman told us, that the ICMR has definitely taken a decision that we are going to screen more people, but for that the guidelines are not yet issued. Whatever the guidelines are there, it is only for the close contact and the people who came from the outside.
Okay, let me just go across now. We're also joined by Dr. Deepali Bhardwaj. She's been following the corona outbreak very, very closely. Dr. Bhardwaj, the ICMR, the Indian Council for Medical Research, has said that there would be an increase in the number of tests which are being done for patients in this country, but there doesn't appear to be anything to suggest that private players can actually do the testing themselves. In a situation like this, shouldn't private agencies be also involved, given the fact that this is very much it's almost like a war that we are fighting?
Yes, yes. A very good question. But, I don't think in our country getting the private institutions and players to start doing the test is a good idea, because the surveillance, the counts, the positive reports might not get accounted for, and those people might not come up and come in front to be a part of the epidemic. I think, but my suggestion, which I strongly feel, is that the quarantine facilities, the carrying facilities, which our country is doing phenomenal work in getting people indoors, the funds are not going to be there. And the stage 3 is very near. It is nearer than what we are feeling and fearing. So I feel that to increase the funds for those purposes, so that more tests can be increased, quarantine should be maybe made paid. And also I strongly feel that, people who are coming from international travel who can pay should be paying, so that more tests can be conducted, more PCR kits can be created at Pune, and more centers in different metropolitans under government surveillance strictly.
Okay. We've got a call from Tavish, calling from Chandigarh. Tavish, go ahead with your question.
Yes, good evening, Mr. Vishnu. I have a question for the doctor. As a dental practitioner myself, are there any guidelines which we have to follow when examining a patient, particularly a child patient? Actually, I'm a periodontist, which are concerned with the child treatment, dental treatment for the child. Are there any guidelines which we have to follow, and what are the various precautions we must be doing in a dental setup? I have a question.
Okay, so your question is about children. Let me put that across to Dr. P. Raghuram. Dr. Raghuram, would you like to take that? Anything specific that we need to be doing differently for children?
Not really. I think it applies, the same rules apply to everyone. And I just like to go back to the issue that was raised a little earlier on in terms of increasing the facility to screen more people, or shall we take it a little later?
Okay. We've got one more call. What's the name of the caller? We've got Kavita from Coimbatore. Kavita, go ahead with your question. Sorry, we've got Saurav from Gurugram. Saurav, go ahead with your question. Yeah.
Hi. So my question is, if I understand it correctly, the mortality rate for coronavirus is quite low. So why is there so much panic? Is this being fueled by social media?
Why is there panic? Is this being fueled by social media? Dr. Bhardwaj, would you like to take that? Is this panic being fueled by social media?
Yes. People in fear are actually losing their prudence and sticking to stigmas. And I strongly feel that in our country, you also are well aware that your channel is going to help in breaking that always. So people should be alert, prudent, and reading the WHO and Ministry of Health website and their all the guidelines they are giving. But the panic is not needed, because the mortality is low and it's only going to be affecting senior citizens. Of course, in viruses, mutation happens, different strains will come up slowly in next few months. But what is the current scenario? This panic is going to kill us more. So please let us have lesser panic. Very important.
All right, lesser panic is important. Okay. We've got Anup from Noida. Anup, go ahead with your question.
Yeah, good evening to everyone. I have a question. Like they have set one criteria. I had a fever. And some back headache from last 3 or 4 days. So my question is, they have a criteria like if I have been traveled from such countries where there are most affected people. So 90% of the cases in India have been traced as a positive because they didn't travel to anywhere in the country, right? They are from local. So how would you decide that first screening, they are not taking me as a screening because I didn't travel to abroad. So how is authentic, like, might be I have a coronavirus, but they are not taking into consideration for myself because
All right.
I have spoken
Okay,
to.
let me try and take that to Dr. Lahani. The question is this, that, and I think it's an important question, that there is a lot of care being taken about people coming into our country. Many of them are being tested, others are being quarantined. But what about those who are traveling or who are in our country without any travel history? How can you be sure that they have not been infected?
Yes, I think it is a very, very important question. But what has happened now, the government guidelines, what today we are investigating the patients, it is not only patients who came from the other countries, but also those who came in contact with the person who came from outside India. So that both things we are investigating. And I think for that what has happened, it should not be more panic, but yes, ICMR is now going to issue the guidelines, and I think within 1 or 2 days we will be able to investigate such type of people who have got the doubts. But for that definitely the government guidelines will be accepted, and according to government guidelines we will investigate such type of patients in future.
Okay, let's go across now to Balu from Bengaluru. Balu, go ahead with your question.
Doctor, I've been suffering from severe depression for the last 20 years, and I'm also a diabetic. Should I have to take any extra precaution for this coronavirus?
Okay, he's a diabetic, and would you like to take that question, Dr. Raghuram? He's a diabetic, and he's been taking some other treatment as well. Now there is COVID. Does he need to take extra precautions?
No, stick to
None at all.
Sorry.
None at all? Okay. Anjali, go ahead. Deepali, go ahead.
Yes, please again, Vishnu, the question, sorry.
All right, let's just try and get that question again. Balu, would you like to repeat that question?
Depression.
All right, so he's had depression for many years, number one, and number two, he's diabetic as well. So in a situation like this, does he need to be extra careful about COVID?
It's only the senior citizens. He sounds like a young person to me on this national channel, and he should be lesser stressed, and more panic, more the stress. Your immunity will always be lesser if you're in depression and stress. So let's all stay calm, let's stay together, let's believe in our government, and let's be a society where we can help prevent this spread. And I would like to add, as the previous person said, because of lesser tests, of course, the stage 3 is seeming to be very much nearer, because somebody who is a suspect is traveling and meeting people. So we all must get together and follow as much of precaution as we can. Please, that is what is needed.
All right, thanks. I'd like to thank
may
all
I
of you.
add,
Go ahead.
point?
Go ahead. Yes, sir, go ahead.
Yes, actually, what ICMR is planning to do is to take about 10 samples a week from various centers, to check out whether this will work, but basically, people who have flu-like symptoms must be checked so that we know whether there is spread in the community or not. And widespread testing must be done. And I think I would like to differ, and I would like to add that the NABL accredited laboratories must be given the permission to do it. Basically, they should collaborate with the ICMR and with the government. And unless we do it on a large scale, we won't know whether we should encourage social distancing to this group of people and take precautions, because South Korea is doing it very well. And I think India has that small window of opportunity, and in the next month, we need to do all that is required to ensure that this community spread doesn't happen. At this moment in time, we clearly don't know whether this has happened or not.
All right, we'll leave it over there. I'd like to thank all of you very much for joining us and taking those questions. It's time now for us to take this short break.